So this study, as you know, it was a global trial that close to 1,000 patients with gastric cancer, unresectable, both distal esophagus and also stomach cancer, were randomized between the standard of care, which was chemotherapy, or chemotherapy plus the Tislelizumab, which is an anti-PD-1 inhibitor. And the idea behind was to see whether or not adding this immunotherapy as first-line therapy added value. And this was published recently at the British Medical Journal, where we showed that patients that were randomized to receive the anti-PD-L1, right, Tislelizumab, in addition to the chemotherapy, which is the backbone, had a better, survival. So the overall survival was higher for everyone. Those patients that had the biomarker, the PD-1 receptor, PD-L1 receptor, or those that did not exhibit that. So this actually really was very encouraging, because we already have data right now that patients that even they don't have the biomarker, they will respond, and they had approximately 25% better survival in the 3-year follow-up, compared to about 20% survival in the group that was receiving the immunotherapy as compared to standard of practice. So this really is a new alternative, was recently approved by the FDA as first-line therapy. And one of the advantages of Tislelizumab as compared to other anti-PD-1 or anti-PD-L1 therapies is that, first of all, it doesn't require for the tumor to express the biomarker. The second factor that we think that could have had a lot of weight is the fact that the way that the molecule works, it stays longer. So the adhesion, right, the inhibition is longer, and it's less likely to be phagocyted, right, by the macrophages, because it basically blocks that pathway. So that those were the things we knew at that point. During this ASCO GI 2025, we're talking about the patient-reported outcomes in this same cohort. So the study was designed with this in mind from the beginning. So patients, help complete multiple questionnaires that are related to the quality of life, that are related to, not only how do they feel, but also are they able to carry on their activities? Are they having pain? So there were many metrics, and in almost every different metric of patient-reported outcomes, especially the nutrition part. As a GI doctor, I care a lot about my patients being able to eat. And when you have gastric cancer that is unresectable, right, the first thing we see is that patients have pain and they are not able to eat well, so their weight goes down dramatically. So when we look at these PROs, right, the patient-reported outcomes, and every area, including that abdominal pain, was significantly improved as compared to the standard of care when patients were receiving the Tislelizumab. So that's the new data that we have, and there are multiple surveys, and you can see we have it presented in the poster that is available. We presented earlier today, and it's across all the different aspects. So it's very good news. It's very good news because it works. It's very good news because it's also cost effective. There have been a few analyses that have looked into the cost, and Tislelizumab in China, the studies demonstrated that the drug it's cost effective. So it's lower than the threshold that the country has for expenditure of the drug. In the USA, it didn't pan out like that. So none of the anti-PD-L1 are really cost effective with regards to that threshold, right? I mean, they cost more, unfortunately, but we know that it works.